very special guest with us, someone who knows a thing or two about standing up to cancer like so many of you. Please help me welcome Mary Kay to the stage.
Go, Mom! Woo!
Boy, following Mary Clark is a little difficult. My name is Mary Kay Kudulis, and I am a 3-time cancer survivor and currently fighting cancer again. I have a brain tumor, and it's hard. My story begins in the fall of 1997. I was living in Berwyn, Illinois with my husband Dan and our 2 young children, Veronica and Jim. I was in reasonable good health until late September. I developed what I thought was a sinus headache, and it wouldn't go away. My family doctor kept telling me to take sinus medication, and eventually it would go away. And finally the headache did subside. But then my vision became weird and blurred, and I went back to my family doctor, and he suggested that I needed to have my eyes checked at the optometrist, and as he felt that my vision had just changed. Took his advice and went to Rosen's and saw a wonderful doctor, and he ran every test he possibly could think of. And finally, the last test he did was to dilate my eyes. And once he did that, he saw that my optic nerves were very swollen, and he told me that if I were 70 and on high blood pressure medication, this would be a normal thing. Except I was only 28, and my blood pressure was normal. He told me then that I would have to go to the emergency room immediately, and if I had to wait until the morning, that would be okay, but I needed to go now. He also suggested that I should tell them at the emergency room that I needed to have a CT scan immediately. I was kind of stunned. I just thought I needed to have new glasses and contact lenses, and I was rather shocked that this was as serious as it was. So I left the optometrist's office. Now mind you, it's late October. It's dark outside. My eyes are dilated. I can't see. And I'm behind the wheel of a car. My kids are at my parents', Grandma and Grandpa, and my husband's at bowling. I arrived at my parents' house where my dad starts questioning where I've been for the past 3 hours, and he thought I decided to take advantage of my free time without the kids to go shopping. I had to explain that I hadn't been shopping, and I needed him to call my husband at the bowling alley to tell him to leave now. When Dan gets to my parents' house, I have to explain everything that went on with the eye doctor and that we needed to leave to go to McNeil Memorial Hospital's ER. Once we're there, we're greeted by the crabbiest ER nurse that I've ever met. And I've had my fair share of ER nurses over the years. I have all my paperwork from the eye doctor verifying that I'm not on drugs. But the nurse still would not listen and take care of us. After we were there over an hour, I became quite irate and demanded that we see the head of the ER. We got lucky because the head ER doctor heard me and was unaware of my situation. She took us to the office and listened to my story. Her recommendation for us was to go to LaGrange Hospital, where my doctor at the time practiced. She was very interested in finding out what my diagnosis was and asked if she could contact her when I had all my details. McNeil then called LaGrange to let him know that we were on our way. And when we got there, they whisked me off to have my CT scan. And then Dan and I were lucky enough to spend the night at LaGrange Hospital. It was a challenge when every 45 minutes you had a nurse come to check on my vitals and ask questions like, have you noticed any personality changes? Do you know your name? Do you know your husband's name? Do you know where you live? Do you know where you're at? It became to a point where Dan and I, all we could do was laugh all night long. How do you sleep in a situation like that? Later that morning, we were told that the CT scan showed that I had a mass on my brain and that I would need to have an MRI later on that day. Well, the MRI did show that I had a mass, and the mass was solid. I needed to schedule a biopsy, and I had a new neurosurgeon, Dr. Robert Kazin. A week later, I had the biopsy performed at Adventist Hinsdale Hospital. And once I had the biopsy sample was sent to the Mayo Clinic in Minnesota. I have to be honest, having the biopsy was not easy. I had to wear a surgical halo that was screwed into my skull. And even 14 years later, I hate thinking about this. It was one of the worst things I've had to deal with, and I got to do it twice. It was cumbersome, and even with the Valium I was given, it didn't help. My wonderful daughter used one of the photos of me wearing this as part of her Relay for Life donation page to illustrate what some cancer patients must endure. It definitely had an impact on people, but seeing it still makes me cry. The result of my biopsy was The result of the biopsy that I had showed that I had an oligodendroglioma brain tumor. The first time I had to do this, and now I'm getting emotional. On November 13, 1997, Dr. Kazin performed a partial frontal lobotomy, removing a tumor the size of a golf ball from the frontal left lobe of my brain. After that, I did 6 weeks of radiation treatments, every day, 5 days a week. Then, after a few MRIs between Dr. Kazin and his associate, Dr. Anthony DiGianfilippo, they noticed a spot on my brain that they didn't like. Unlucky me, another surgery. I remember a few minutes ago I told you about that halo. Well, I got to wear it again for the radiotactic surgery done by Dr. DiGianfilippo. Then after all of that, everybody was happy, and I was clean, and I had no more problems. 18 months later, I found out I was pregnant with my 3rd child. I also found out that I had thyroid cancer. Another surgery, what a joy. This time, I had to wait until my pregnancy I was in my 2nd trimester, and this time I was more terrified. I came through just fine, and so did my baby. And after my son Sean was born, I had to have one more surgery to remove the rest of my thyroid. All was going fine, and I had a clean checkup, and for 9 years, I was fine. Until 3 years ago, when my oligodendroglioma decided to make itself known again. Brain cancer decided to return. I was re-diagnosed on Valentine's Day of 2008, and I've been undergoing treatments ever since. This time, my brain tumor is located in my language core, so surgery is not an option, as it would rob me of my ability to speak and think. I cannot have radiation treatments because I already reached my maximum amount allowed fighting it the first time. So it leads me to chemotherapy. I've been on several different types, but found only 2 that work for me. The first one is CCNU or CNU. This chemo has been used to shrink the tumor, and the second one is Avastin, and this is used to prevent blood vessels from developing, which would allow the tumor to receive nourishment and grow. I just recently finished with CNU about 3 months ago, and it was done in 7 rounds of this pill, a pill that lasts for 5 days, and we did it like every 7 to 8 weeks, and most people can only tolerate 3 to 4 rounds, and I did it for 7. And then I had to stop because prolonged use of this drug does do damage to your bone marrow. But the positive aspect of this drug is that I was allowed to administer it myself at home, and I didn't have to go to the hospital for it. The second chemo that I am still on is called Avastin, and it is an IV treatment, and that is, of course, provided that my platelets are where they need to be. Avastin is administered by IV, and I have to go to Evanston North Shore Hospital. My husband Dan does drive me an hour and a half to go get this 20-minute treatment, and then we get to drive another hour and a half home. I have to admit, Avastin does make me hungry and tired, so he usually buys me lunch, and then on the way home I get to sleep. While Avastin has been effective in treating my tumor, it also has left me with some side effects. It has affected my blood pressure, it has caused it to go high, and it has also left me with blood clots in my left leg, and now it has caused some side effects with my kidneys, which the doctors are keeping track of now. But no matter what the issues have been, I have learned to deal with them. I have my down times emotionally, but I have a tremendous support system with my family and friends every step of the way. I am loved and cared for, and I can call these people anytime, day or night. And they're always there for me. Without them, I couldn't make it through all of this, and I thank God every day for them in my life. In spite of all that cancer has put me and my family through, the one thing that binds us all together is faith. Faith gives us the strength to keep us fighting, even when we're tired and don't think we can fight anymore. It gives us the ability to push through the unknown challenges still ahead. We place our faith in God to get us through the tough times, and He always has. To all my fellow cancer survivors, I ask that God continues to bless you and your families, and to pray that one day events like Relay for Life will no longer be necessary. Stay strong, keep fighting, and never ever give up. I'd like to close by reading a poem to you that I keep on my fridge in the kitchen. And until recently I hadn't read it because I forgot about it, but my husband Dan reminded me that I had this. It's titled Don't Quit, and it's by Anonymous. When things go wrong, as they sometimes will, where the road you're trudging seems all uphill, when the funds are low and the debts are high, and you want to smile, but you have to sigh, when care is pressing you down a bit, rest if you must, but don't you quit. Life is queer with its twists and turns, as every one of us sometimes learns. And many a failure turns about, when you might have won had you stuck it out. Don't you give up though the pace seems slow, you may succeed with another blow. Success is failure turned inside out, the silver tint of the clouds of doubt. And as you never can tell how close you are, it may be near when it seems so far. So stick to the fight when your heart is hit. It's when things seem worse that you must not quit. I look forward to seeing all of you survivors and caregivers out on that walkway to walk with me on that survivor walk.